Some important information regarding thigh muscles. Short head of biceps femoris is not hamstring muscle. It is supplied by common fibular part of sciatic nerve. Posterior view of right sided ischial tuberosity. Transverse view of thigh. These diagrams you check in your textbooks. Any muscle which pulls the femur anteriorly crosses the hip joint anteriorly, like iliopsoas muscle for hip flexion. Any muscle which crosses the hip joint posteriorly pulls the hip joint posteriorly, like gluteus maximus for hip extension, assisted by hamstring muscles. Iliofemoral ligament, strongest ligament, prevents hyperextension of hip joint. Attaches to ilium of hip bone and femur. Extension at hip joint is a limited movement. Flexion at hip joint is a large movement. Rectus femoris. Rectus femoris, part of quadriceps femoris. It is working on two joints: knee joint, extension, first action; hip joint, flexion. Knee joint, first action, extension; hip joint, flexion. Rectus femoris, knee joint, extension; hip joint, flexion. Chief extensor of hip, gluteus maximus, assisted by hamstring muscle. Hamstring antagonizes the function of quadriceps. Chief extensor of hip, gluteus maximus, assisted by hamstring muscles. Hamstring antagonizes the function of quadriceps. Gluteus region muscles. Gluteus maximus, largest, most superficial. Most fibers inserted in iliotibial tract. Some fibers inserted in gluteal tuberosity of femur. Gluteus medius, in middle, origin hip bone. Insertion, lateral surface of greater trochanter of femur. Lateral surface of greater trochanter of femur. Gluteus minimus, more anterior, origin hip bone. Insertion, anterior surface of greater trochanter of femur. Anterior surface of greater trochanter of femur. Gluteus maximus, gluteus medius, gluteus minimus. Gluteus medius and gluteus minimus crosses hip joint anteriorly. Medially rotates hip joint. Abduction, crosses hip joint anteriorly. Medially rotates hip joint. Abduction. Gluteus maximus crosses hip joint posterior. Chief extensor of hip joint. Posterior view of gluteal region. Short lateral rotators of thigh. Piriformis, obturator internus, superior gemelli, interior gemelli. Short lateral rotators of thigh. Piriformis, obturator internus, superior gemelli, interior gemelli. Quadratus femoris, obturator externus. Short lateral rotators of thigh are piriformis, obturator internus, superior gemelli, inferior gemelli. Quadratus femoris, obturator externus. Quadratus femoris, obturator externus. These muscles antagonize the action of gluteus medius and gluteus minimus. Medially rotates. These are lateral rotators, so antagonize the action. I am again repeating. Piriformis, obturator internus, superior gemelli, inferior gemelli. Quadratus femoris, obturator externus, antagonizes the action of gluteus medius and gluteus minimus. Superior gluteal nerve supplies gluteus medius, gluteus minimus, tensor fascia lata. Inferior gluteal nerve supplies gluteus maximus for hip extension. Tibial part of sciatic nerve supplies hamstring muscles. Common peroneal nerve supplies the short head of biceps femoris. Tibial part of sciatic nerve supplies hamstring muscles. Common peroneal nerve supplies short head of biceps femoris. Gluteus medius, gluteus minimus, tensor fascia lata has three actions. Abduction of hip joint, medial rotation, stabilizes the pelvis while walking. They work like a anti-gravity muscles. Abduction of hip joint, medial rotation, stabilizes the pelvis. Gluteus medius